Welcome to Dental Tinkle. Today we are going to learn about the Oral Hygiene Index, that is the OHI. This index was developed by John C. Green and Jack R. Vermillion in the year 1960. This index was developed to classify and assess the oral hygiene status. There are two components in this index. The first one is the debris index and the second one is the calculus index. Number 23 Explorer or the Shepherd's Hook Explorer is used to measure the debris index, whereas number 5 Explorer is used to measure the calculus index. This examination is carried out in 6 segments. The first segment includes the upper right posteriors. Second segment includes the upper anteriors. Third segment includes the upper left posteriors. Fourth segment includes the lower left posteriors. Fifth segment includes the lower anteriors. And the sixth segment includes the lower right posteriors. Third molars are not included in the examination. Now coming to the basic rules, only fully erupted permanent teeth are selected for the examination. As I have already told, third molars are not included as a part of the examination. And we have 6 segments and we have to select one tooth from each segment. And what is that one tooth? The tooth that has the greatest surface area covered by debris is selected for the debris index, whereas the tooth that has the greatest surface area covered by the supragingival or subgingival calculus is selected for the calculus index. And you have to take a buccal score and a lingual score. And a very important rule is that the buccal score and lingual score need not be taken from the same tooth. Now, after taking the scores, you need to calculate the OHI, that is the Oral Hygiene Index. So first you need to calculate the debris index and calculus index, for which you need to add the buccal score and lingual score divided by number of the segments that are scored. After taking the debris index and calculus index, you have to add them both in order to obtain the oral hygiene index. Now, how to do the scoring? So for the debris index, 0 means no debris or stain is present on the tooth, whereas 1 score is given when the soft debris is covering not more than 1/3 of the tooth surface, or if you see any extrinsic stains on the tooth surface. So these extrinsic stains can be present on the tooth surface regardless of the surface area, which means you may see stains only on the 1/3 of the tooth surface, or the stains may cover the whole tooth surface, but the score still is 1. The score 2 is given if the soft debris is covering greater than 1/3 but not more than 2/3, and score 3 is given if the soft debris is covering greater than 2/3 of the tooth surface. Now, how to score the calculus index? Score 0 is given if no calculus is present on the tooth surface. Score 1 is given if the supragingival calculus is covering not more than 1/3 of the tooth surface. And score 2 is given if the supragingival calculus is covering greater than 1/3 of the tooth surface but not greater than 2/3 of the tooth surface. Or even if there are any individual flecks of the subgingival calculus, then also the score is 2. And score 3 is given if the supragingival calculus is covering greater than 2/3 of the tooth surface, or if you see a heavy band of calculus in the subgingival region. Thank you.